Hello, my wonderful viewers and returning subscribers. You're welcome to your one and only Dr. Winnie the Pharmacist YouTube channel. If you just seen my pretty face for the first time, my name is Dr. Winnie. I'm a board certified pharmacist and a practicing herbalist. This is my YouTube channel where I discuss all things health. Today I'll be discussing drugs that can be affected by vitamin A or retinol and vice versa. That is, drugs that can be affected by vitamin A or retinol and drugs which vitamin A or retinol may affect. So I'll be discussing both ways. Now let's, without wasting much time, dive straight into the topic. So I'll be looking at 5 things today, namely 1. Statins are a group or class of drugs that are used to lower cholesterol levels in the body. A very good example of statins is simvastatin. I know that a lot of people are very used to these names I'm calling, especially patients who are obese, people who are taking drugs to reduce their obesity. Okay, so a good example of statin, like I've said, is simvastatin. And an example of a brand of simvastatin, a common brand, is Zocor, spelled Z-O-C-O-R. Number 2 is niacin or vitamin B3. Niacin is spelled N-I-A-C-I-N. So these 2 drugs are affected by vitamin A, and I'll tell you how. The effectiveness of simvastatin and niacin can be decreased if the patient is taking beta-carotene with selenium and vitamins E and C. Now, before I continue, I'd love you to know that niacin, which is also vitamin B3, is used by the body to turn food into energy. It also helps to keep your nervous system, your digestive system, and your skin healthy. So simple logic, if vitamin A is said to decrease the effectiveness of the statins, simvastatin, for example, and niacin or vitamin B3, it simply means that the patient will think that he's taking or she's taking simvastatin or a statin, and it's supposed to be working to decrease or lower cholesterol. But rather, the effectiveness, remember, by virtue of the fact that that patient is also on a vitamin A supplement, the effect is that the cholesterol is not being lowered. So the drug is not working. The effectiveness has been reduced. Then the patient will be like, oh, I'm on this drug, but it's not working. And the healthcare provider may not even know if you don't tell them and if they are not alert. And in the case of niacin, the integrity of the digestive system, the nervous system, and the skin will be affected. Not only that, the rates at which the body turns food into energy too will also be affected. So you can see one thing leads to another. That's why we should be very, very careful with what we take into the body, especially when it comes to drugs and supplements. And that is why my singular advice to people has always been, please always consult a qualified healthcare provider before you start taking anything like drugs. You get it? Or even supplements, please, so that you can always be on the safe side. Mark my words, qualified, not just anybody, a qualified healthcare provider, please. Now, in the first and second cases, we were looking at how vitamin A affects the drug which one is taking negatively. But in this third case now, we shall be looking at the vice versa. So in this third case, the drug is now the one affecting vitamin A. Remember in the beginning of this video, I said I was going to be looking at both sides. That's vice versa, how vitamin A affects the drugs and how the drugs affect vitamin A. So let's move. Some cholesterol lowering drugs like cholestyramine and cholestyramine can reduce the blood dietary levels of beta carotene by 30 to 40%. Did you get it? The fourth example I'm going to give to also affects vitamin A negatively. So after talking about this fourth example, then I'll also talk about, these effects or negative effects that these drugs I'm mentioning now have on vitamin A means that we have to take action. So I'll talk about the actions that we will take to reboost the vitamin A, because vitamin A, despite the fact that I have been mentioning the negative effects of vitamin A and excess vitamin A, if you remember, like I said in my previous video, is a fat-soluble vitamin and a very, very essential nutrient. So when we have low levels of vitamin A, it means we are going to run into problems. In fact, I'm going to do a separate video on vitamin A and the benefits and the sources and how one should take them as a form of wrap-up series for this vitamin A that we've been talking about for a very long time. So I would like you to know that vitamin A, in as much as when you take it in excess, it becomes detrimental to the body system, that vitamin A is a very, very, very important nutrient that should not be joked with. Because if one has or suffers from deficiency of vitamin A, one could come down with a lot of problems too. So the fourth drug that we are talking about here is Orlistat, spelled Orlistat, Orlistat. A common brand name for Orlistat, or a common brand or common brands, are Zenical and Ali. I'll put them up here for you to see the spellings. I know that many people who are trying to control their weights with drugs are used to these names that I'm calling. So like I've said, Orlistat is a weight control drug or medicine, and it can undermine the absorption of beta carotene by up to 30%, resulting in low blood beta carotene levels. And advice: those choosing to take a multivitamin while on Orlistat should take them at least 2 hours before taking the medication. That's the Orlistat. Now, if cholestyramine, and Orlistat reduce the beta carotene levels of vitamin A levels in the body, or the blood levels of the dietary vitamin A levels or beta carotene levels in the body, it automatically means, common sense or common logic means that we will have to boost. That means we'll have to increase our intake of vitamin A rich foods. Or we can talk to our healthcare provider and consult with them so that we know whether we can take a vitamin A supplement. At this level, it may be safe to take a vitamin A supplement because we already have a drug that is cutting down or reducing the blood level of vitamin A. And we know that when vitamin A is reduced, it will eventually lead to vitamin A deficiency. And vitamin A deficiency has its own downsides. It has its own very bad and negative effects. Like I already said, I'll do a separate video for that, about vitamin A deficiency and how to avoid them. Thank you. The fifth drug that we are going to be looking at here is mineral oil. Mineral oils mineral oils are used in the treatment of constipation and can also reduce or lower the blood levels of beta carotene. So like I said, the same thing applies to the other drugs that lower beta carotene or blood levels of vitamin A. We'll have to boost our vitamin A intake in order to compensate for the reduction of our normal vitamin A level. Lastly, just a quick one. I'd love you to know that alcohol consumption can interact with beta carotene or vitamin A, thus raising the chances of one developing liver problems. With this short and very informative narrative, I've come to the end of this video. So, as usual, I'll implore you to please kindly subscribe. Just hit the subscribe button. It doesn't cost anything. And also hit that notification bell. It's usually black in color. Hit the notification bell so that you'll be aware anytime I drop new informative videos like this. Also, share. You know, we said this is a health awareness creation channel. So share it and make it go viral so that we can liberate the world, so that people who do not know may know and take positive actions towards their health behaviors. Also, I'd like you to give these videos a thumbs up or likes if this video has blessed you with information and increased your knowledge base. Please give these videos thumbs up and likes. I'd also implore you to kindly drop your comments in the comment section and put down your questions too. And as per anything that you don't understand, I'll answer. Also, please put down suggestions of topics you'd like me to discuss in the comment section. That said, thank you very much for watching. Till we meet next time.